Hello and welcome to IHW Council's special web show, Osteoporosis, a Silent Killer, powered by Dr. Reddy's. I'm Anisha Nayathavan, your host for the show. Osteoporosis literally means porous bone. That fractures from osteoporosis are more common than heart attacks, stroke, and breast cancer combined. It is estimated that over 200 million people worldwide suffer from this disease. At least 40% of these are women. Osteoporosis is a major public health problem, through the associated fragility fractures. The most common site of fractures are hips, spine, and wrist, and these have enormous health and economic impact. Today, we are joined by a panel of experts who will talk about osteoporosis, who is at risk, what is osteoporosis, how is it diagnosed, and how is it treated and managed. So please welcome our panel of experts. Please welcome Dr. Bharat Dave, Director, Spine and Spine Surgeon, Satya Spine Hospital and Research Institute. Please welcome Dr. Sanjay Kapoor, Senior Consultant Rheumatologist, Indian Spinal Injuries, New Delhi, and Dr. Sanjay Badada, HOD Endocrinologist, PGI, Chandigarh. A warm welcome to all of you gentlemen. Thank you so much for joining us this morning to discuss this important issue of osteoporosis. Let me start with you, Dr. Dave. If you could tell us what really is osteoporosis and can you explain how it happens?
Good morning, viewers. Osteoporosis, the word has come from the Greek osteo means bone and poros means, it is becoming weak and it becomes porous. So that means that the bone is becoming porous. So the normal strength which is bone supposed to carry on is not able to do that. And that affects the overall performance of an individual. Bone being the central skeleton, the fracture tendency occurs just by the trivial fall, or even sometimes the bone is so weak that the fracture occurs while patient is even in bed. So that is called osteoporosis, and it has become a major health issue. We call this as a silent thief because the bone is getting weaker and weaker without awareness, without being known to the individual, like the diabetes and the hypertension. The awareness about both this condition has led to a lot of issues, morbidity, which was happening earlier. It doesn't happen anymore. We used to see a lot of patients who were walking with the paralysis. Now you do not see anybody walking in the street with the hemiparesis because of the hypertension. And same way the diabetes as well. So osteoporosis means the weakening of the bone that happens with the age, and there are different types of the osteoporosis as well.
Okay. Does this happen to everyone? Dr. Dave is saying that this is the weakening of the bone happens with aging. So Dr. Kapoor, will everyone get osteoporosis?
Yes, I mean more or less yes, we can say with the age everybody gets osteoporosis. I would like to go into the pathogenesis of osteoporosis in the sense that why it happens as you were asking. The thing is that that it depends on the peak bone mass which occurs, which we achieve in the age group of 20 to 40 years. So it is very imperative that we should start the treatment or prevention of osteoporosis right in the childhood. That means that calcium intake, the food intake, our habits should be inculcated in such a way that we should reach the peak bone mass. That is very essential, and that cannot be achieved if we give a lot of calcium to our adulthood females. A lot of them are deprived of calcium and milk in this age group because of the scarcity and because of the poverty. So that is why they are not able to reach able to reach the peak bone mass. That is their bank balance, because that has to be deprived after the menopause. So if you have a large bank balance, you can take care in the adulthood as well as in the elderly situation also. So more or less, male and female both have osteoporosis or weakening of the bone does occur over the period of aging as aging grows. But the thing is that females have more osteoporosis because they are protected by the estrogens levels, which fall rapidly after the menopause. So they do not have any protection. So their bone mass and the osteoporosis is much faster than the males. Although in certain situations, it can occur in the males also, which is we know is a secondary osteoporosis. The one thing which I would like to emphasize is the smoking. Smoking is a very big risk factor for the osteoporosis and the alcoholism. So these two are the big factors which should be avoided at all costs, so that if we want to prevent osteoporosis. So smoking, which is more prevalent nowadays, even females are smoking, we see it, and alcohol also, which is increasing. So we should be more protected about it, and we shouldn't tell that. I mean, beside other things which has been in circulation about the side effect of the smoking, but arthritis and osteoporosis is one of them, which is very, very imperative. So I can say that, I mean, by increasing the calcium intake in the childhood and adulthood, we can prevent osteoporosis, and it happens to everybody. But if our peak bone mass, that is the bank balance of the bone, is there, then we have lesser chances of developing osteoporosis. And even if we develop the osteoporosis, we do not develop fractures. So that is very, very important.
Okay. Dr. Vadada, Dr. Kapoor said that we must build a bone bank. I want to understand who is more at risk. In childhood in our country, many people don't have access to milk every day. And I'm trying to understand who's most at risk. Is it those who had a poor nutrition in the childhood? Is it women after menopause? Is it some people who've had particular diseases who then become more prone to osteoporosis? Who is most at risk?
So, the osteoporosis, the journey starts with osteoporosis in utero itself. When the baby is in the mother's womb, that start problem there itself. The mother's nutrition is not good, then baby's bone mass is not good. So that ultimately less bone mass, meaning by that rapid loss of bone mass. So what Dr. Kapoor was telling, bone balance. So I use a term, bone balance is better than bank balance. So we have to target our bone balance as much as possible. Now your question that who are at risk for the osteoporosis or the bone balance. So anybody who is having any chronic disease, whether it is related to your gastrointestinal tract, whether it is related to your muscles, whether it is related to nutrition or nerves, any disease, chronic disease, individuals are predisposed for the osteoporosis. Then some drugs, those are taken often. In addition to the smoking and alcohol, as mentioned by Dr. Kapoor and Dr. Dave, that another drug which is known to cause poor bone health, that is the steroid, and which is especially in our country, it is available over the counter, and people use indiscriminately those drugs, and that can cause severe damage to the bones. In addition to that, of course, the age is important and the family history of osteoporosis. If a person or a male or a female is having a family history of osteoporotic fractures, those are at very, very high risk of osteoporosis, as well as individuals. Suppose a person developed a fracture some point of time, he is at more risk to develop again another fracture. We use the term fracture begets fracture. If the one fracture, then it is more liable to develop the another fracture.
Okay. So what can we do to reduce our risk of getting osteoporosis?
Really very nice question. So
because women will go through menopause, right? The estrogen will drop off.
Yes.
And you only hope that they've had good diets during their initial years, but nobody can confirm or, ensure that that happens. So anything that we can do, Dr. Vedanta, to reduce our risk?
Always there is a saying in medical science that prevention is better than cure. Okay, and a good doctor prevents a disease, a bad doctor cures the disease. So the prevention is very, very important. And as I mentioned, prevention starts from in utero itself. So good nutrition to mother during the pregnancy, that will help to achieve good peak bone mass. Once the baby is out of mother's body, then there comes his nutrition as well as good physical activity. So in our young childhood or the adolescent, we have good physical activity, good sunlight exposure, because the sunlight is a source of vitamin D. So good sunlight exposure will help, and nutrition will help. Of course, the exercise will help a lot. So we should ask our kids to have regular exercise. That is very, very important in addition to the nutrition. Unfortunately, nowadays the trend is that on Wednesday, one pizza, you ask order for one pizza, another pizza is free. But that does not contain good amount of calcium, vitamin D, and other nutrition contents. So we have to encourage our kids. We have to inculcate a habit of good nutrition in our kids so that they can learn and they can have. During now the same baby, now the lady becomes the pregnant, then we have to take care of the pregnancy part. Once they enter the menopause, we have to plan their treatment. We have to investigate them in time that what is their bone mineral density. That is can be done by easily by a technique that is called DEXA scan. So they can be screened on time. If they have a problem, then they can be treated adequately in time. So one stitch in a time saves 9, something like that. So the early treatment, early initiation of treatment and good screening will be very, very helpful. The male part of the osteoporosis, the same thing will go on. Their nutrition, their exercise, but fortunately male does not have that kind of menopause kind of situation. Their testosterone hormone will persist for a longer period of time and it will goes down. It is very slow process. So that's why the BMD fall is not rapid in the male. But unfortunately, once the male patient develops osteoporosis and fracture, then their outcome is much, much poorer than what is there in the female. So God is great. I'm happy that he is taking better care of the females for if they have osteoporosis and fracture as compared to the males.
Okay. Dr. Dave, we will understand how we diagnose osteoporosis during the course of the show. I want to understand that, everybody expects as you grow older, you become more frail, you're more prone to fractures. But how does one diagnose that you have osteoporosis? What are the symptoms? Any telltale signs that, this is not normal, something is abnormal?
Yeah, I think excellent question. That is why it is called silent thief. So what we have been addressing practically, the word is awareness. Awareness and awareness. That's why we are here for Sunday morning, an hour with you guys, with everybody, to share what is awareness, the meaning of awareness, and the meaning of, what can we do for this. Basically, how do we diagnose? There are no symptoms, there are no signs of osteoporosis in the early stage. When the fracture has occurred, the bone is already eaten away by the osteoclast. That's a cell name, osteoclast, and that is why the bone is eaten away and bone has become weak. And that is because of the hormone withdrawal. And there are various reasons mentioned by my previous two colleagues. So loss of height is something that is to be considered as the primary symptom. So what we have been narrating to practically all our age-old people, that start measuring the height. So we used to do the measurement of the height when we were young, behind the door of our house. Oh, you have grown in 1 year this much height. We need to do the same thing for the elderly. You have lost this much height. And height loss can be considered as one of the primary symptoms. The second will be rib pain, pain in the shin bone, pain in the muscles, pain all over generalized. They have to be investigated as well. So these are the salient features. As mentioned by Dr. Sanjay, that DEXA scan is something which we can do, and repeat DEXA scan has to be done. So postmenopausal women, if they have symptom or even without symptom, we can include, and it's been included into the health checkup as well, to get the BMD done. So in short, we need to address the bone bank as been mentioned by the previous two speakers, by increasing the physical activity. By age 35, we should have the peak bone mass achieved. Along with that, see the symptoms which I mentioned, generalized symptoms, along with the loss of height.
Okay, this is the first time that I've heard to start measuring the heights of the elders, because heights of only growing kids are usually measured, but this is a great tip. Dr. Kapoor, how is this diagnosed? Both of you have mentioned the DEXA scan, but after all, it's like an X-ray with radiation. People would only go for an X-ray if they think something is, they're coughing a lot and they're in a bad state. Most Indians go for any kind of healthcare only when they're in a really bad state. So is there a blood test or something which is non-invasive, which could be more routine, that could, perhaps show signs that you could be developing osteoporosis, so that, then you go in for more advanced testing like DEXA scan?
Very good question. I mean, yes, in Indian context, it is very, very relevant. And I mean, WHO has also looked into it. So we have a very good tool which does not require any BMD. These are the questionnaire only, which is known as FRAXis tool, and that has been developed for India also. It is an international campaign, and it has been developed for our countries, like where the BMD cannot be seen or cannot be afforded by the people. So we have a very good questionnaire is there, and on the basis of that we calculate how much risk of fracture is there over the lifetime. So if patient falls into 20% fixed fracture of the hip, or more than that, the overall risk is high, we can diagnose straight away without doing BMD, looking at the questionnaire, and that is available both in software format also and the hardware format also. There are questionnaire which is there on the table of ours, which patient fills up, and if patient falls into some category, then we can go for the BMD. So I mean, that has been developed by the WHO, and for the Indian population it has been validated also. So that is a very good tool. So I apply more of FRAX rather than BMD, and BMD has some issues that it is a very, very difficult test to interpret it also. And sometimes what happens is most of the fractures occur when the BMD is fine, in the sense that it is not osteoporotic. So we have to take help of the overall situation. What is the risk of the fall? What is the muscle mass? Is there any neurological illnesses there or not? Is there any, as Sir has asked about the family history, is there or not? Is there any history of hip fracture? Is there any history of alcoholism or rheumatoid arthritis or taken of corticosteroid? So these are the clinical questions which is inculcated in the FRAX scoring system, and that is very easy to do, and there is no requirement for the BMD to do at the first hand. If we suspect that fracture risk is high, then we can straight away start the treatment, and we can monitor with the BMD. So I mean, these are the questionnaire which is available, and that is known as FRAX score.
Dr. Badada, Dr. Kapoor mentioned something about rheumatoid arthritis. There are a few, immune-related problems which some people have, where they are given long-term steroids to manage their conditions. I have also seen people who have chronic asthma. They are also advised steroids for a really long period of time. I've seen it in the case of Pharmacy. She's been having steroids for years and years, and now her knees are all gone because they become so brittle. So is there a connection between those having autoimmune issues, rheumatoid arthritis, and osteoporosis? Could they go on to develop this?
Yes. Okay, sir. Go ahead.
No, Dr. Kapoor, I think it's your area. You better use.
Okay,
Yes.
Dr. Kapoor, go ahead.
Yes, I mean, because I mean, I see autoimmune diseases much more often. So there is a very big risk for autoimmune disease itself. For example, rheumatoid arthritis. And if you say, if you consider diabetes, diabetes is also autoimmune disease. And for example, not at that, hypothyroidism is also autoimmune diseases, and in which risk of osteoporosis is much more. And with the corticosteroid, it is just ice on the cake. That means that osteoporosis is very, very rapid, and more and so the risk of fracture is much more increased than what we are talking about the BMD. So if you are taking corticosteroid, then the risk is 2 to 10 times more, even if your BMD is normal. So that is why, I mean, we do not depend on the BMD in cases where corticosteroids are there, and we start prevention. As you are saying that your Masi or somebody, when we put these patients on the corticosteroid, we see what is their bone strength and what is their FRAX score, and what we say is that primary prevention is much more in those diseases where, I mean, osteoporotic risk fracture is more. That means that if they have autoimmune disease, they have Parkinsonism or their diabetes or their hypothyroidism, hyperthyroidism. I mean, these are the all risk factors where in the fracture risk is much more. And if we give corticosteroid, then it is much more. So we should prevent it by giving certain drugs in those patients, even if their BMD is normal. So that is known as what is known as primary prevention before the fracture occurs. So that has to be done because corticosteroid is something which is very, very essential in certain diseases. But I mean, we have to minimize the dose. Number one, there are other medicines which are available nowadays, so that we should not use corticosteroid for a long time, and we should use the smallest doses. Yes, we try to do it, but as we know that, I mean, sometimes patients are dependent on that. In that turn, we give primary prevention by giving certain drugs to these patients so that they do not develop fracture.
Dr. Padada, would you like to add something? Are there any other medical conditions that could make you more at risk for having osteoporosis?
Well, I think I want to make a statement very simple. Steroid is cyanide for the bones.
But what do you do if you really require like my Masi has long-term asthma? Without steroid, she will not get any breath.
Yeah.
She should be very miserable.
As Dr. Kapoor was telling, if it is required, of course, these are the medicine also. I won't say like that. You should not use. You have to use it. But then you have to optimize the doses. That is one. And there is a protocol to prevent its side effect. So we have to use those in advance so that the side effect on the bones because of the steroid can be minimized. So that is there. So the long list of diseases are there that can cause the poor bone health or the osteoporosis. So you name the system. If there is any chronic disease related to that, that can cause the osteoporosis. Amongst all, the most important one, because I believe this is heard by the all Pan India. So especially in northern part of the country, there is a disease called celiac disease, where that is allergy to wheat is there. And that is a disease which can cause severe osteoporosis. And now even we are getting referrals from down south that they are having the what you call osteoporosis. When they try to look for the what is the cause, they are having the celiac disease. So that is another important disease we must remember, and we should exclude before diagnosing the osteoporosis and starting the treatment, because treatment for that is very easy as compared to treating the osteoporosis. Now, if you are asking me other diseases, so any bone disease can predispose for the osteoporosis. Any disease which makes you immobilize because of some or other reason, or restriction of your physical activity, restriction of activity in daily life, that will also make you prone for the osteoporosis. Then maybe certain malignancies that can make you prone for the osteoporosis. And of course, a list of drugs are there that can make your bones weak or predispose for the osteoporosis. And finally culminates into the fragility fracture. That is the dead end of the what you call osteoporosis. Like high cholesterol, dead end is myocardial infarction. Similarly, osteoporosis, dead end is the fragility fracture. So similar the things are there.
All right. Dr. Dave, Dr. Padada said that, restricted movements could also increase your risk of osteoporosis. Now, I can understand if somebody has an accident, has laid up in bed for 6 months, his risk would be higher. But see, so many of our young generation, all day they're sitting on the computer and they're working, and this is their life. They get less exercise. Maximum, maybe they'll do a walk 3-4 times a week for half an hour or something. Would that also then predispose you to have osteoporosis later in life?
Yes, certainly they all need to have the weight bearing exercise in order to reach peak bone mass maximum by age 35. The younger population, younger generation, now we all have the gym. That is something which is being so many gym. But what one should concentrate for osteoporosis is weight bearing exercise. Doing dumbbells and all those things, they increase the muscle strength, but they do not improve the bone health. So that is very important. So in order to improve the bone health, we need to put stress to the bone. And if you put the stress to the bone, that is called Wolff's law in the medical science. So increased stress will increase the capacity of that particular organ. And that is how we should do that. So we should tighten the stress. And how do we tighten the stress? By weight bearing exercise. So spare some time, maybe 2, 3, 4 times in a week in order to combat this monster coming to us earlier. We all are going to be victim of it today, tomorrow, but you want it to be coming to us late. That is one. There are a few things which I would like to add to the previous conversation. One is a female, they live 7 years older than, they live 7 years longer than the male, and they are hit by osteoporosis twice in 2 ways. One is the menopause, and second is the aging. Both are hit by, the osteoporosis hits both ways, and that is why they are more prone to the osteoporosis. And they become, as I mentioned, their loss of the height. So they become stoop, as the age increases, and that's a sign. Another thing is caveat about my previous 2 speaker, that osteoporosis, and which also you mentioned that, you have to take steroid. Now, if you have to take steroid, which is something which is for somebody, it's a life sort of, saving drug, then they should be started on drug called alendronate, or maybe whatever drug which we can advise and which advised by the doctor. But the caveat here is that drug has to have a drug holiday. And we do see many patients, those who have rheumatoid arthritis or those who are on steroid, they are on this alendronate drug, and it leads to atypical fracture of the femur. And that happens because of the drug side effect. So that is very important. So somebody who is on a medication lifelong, like alendronate, which one has to take it empty stomach every week or every month, they have the drug holiday for 1 year. After 4 or 5 years, according to doctor's advice. That is 2. Third thing, previous conversation has been like, the andropause is the term. We know the menopause for the female. The andropause is the term, like Dr. Sanjay Badada said, that, male, there it becomes a sort of terminal event once the fracture occurs. And he also mentioned fracture begets fracture. So one fracture has occurred, second is on its way. So in order to diagnose that, the male as female, they will have menopause, their mood swings at the age when they have the hormone withdrawal. The male mood will stop, swing. They will become irritable after 70, 75. So family need to understand, because I'm sure each one of us have some or the other elderly in the family. And the minute we see the mood swing in the male, that's where probably the andropause has taken place. This is happening. And the estrogen and testosterone imbalance has started happening. So that is where we all really need to act. And our society and our family need to look after these kind of symptoms as well.
Okay. Dr. Davi, could you tell us what are weight-bearing exercises? Because when you talk about weight-bearing exercise, this is what people think. They pick up a dumbbell and start lifting those weights. What are weight-bearing exercises that strengthen your bones?
Yeah. So again, there are 2 things. You see, somebody who comes to us and says, sir, I have knee pain. How am I going to do weight-bearing exercise? Because this is going to be in the elderly population. So you do activity in your pain limit for we are talking about the elderly. Now, so pain bearing, whatever capacity you have. So weight-bearing exercise means you walk, and whatever capacity you can walk, whatever load you can put into. So swimming is not the weight-bearing exercise. Lying down
that won't
on the
help
bench,
you.
Yeah, swimming is not.
So it will not help your bones.
No, it will help the muscles, but it won't help the bone. It's not a weight-bearing exercise. So weight-bearing exercise means walking, whatever capacity. So young population should walk, either treadmill or whatever way you can, or whatever way they want to, they want it to be followed. And maybe outdoor games, that's also something which one should do. So that is weight-bearing exercise. And somebody who has osteoarthritis and somebody who has osteoporosis, both are, they walk together, because aging is going to affect. So that is where the catch as well. The caveat is you do weight-bearing exercise, but there again in your pain limit, because you won't be able to walk that distance which one should be able to walk. So that is where the drugs will also come.
Okay, the drugs to manage your disease will then help you increase your endurance and walk more. Is that what you're saying, Dr. Davi?
Yeah, sir, I think we should do that. Yeah, we should tighter. We should have the endurance, and we should have the tighter, the activity level. And that is where, a good physical therapist would be of help as well.
Okay. Dr. Kapoor, could we talk about how it is treated? Is there a treatment? Because like we've all agreed that, as you age, your bones become more brittle, they become weak. So is there actually treatment, any drugs that you can take so that you don't get as osteoporosis later in life?
Very nice question. I mean, first of all, I would like to emphasize the fact that we are living in a dark age, in the sense that we are not exposed to sun. So, everybody, if you measure the vitamin D level, which is very low in everybody of ours, although we have sun which is there, and all over the world, it has been found that vitamin D levels are very, very low if we measure in the blood. So the most important thing which I feel that as a treatment, there are two parts of the treatment. One is the primary treatment when the fracture has not occurred, and the secondary treatment is when the fracture has already occurred. So the treatment part is starts with the knowing what is the calcium level to be supplemented in all the people at this moment time, I can say, because we are not exposed because of the air condition or whatever the building structures or whatever you say, but we know that vitamin D levels are very, very low in all over the world. So we should check our alkaline phosphatase and vitamin D level in everybody whom we are suspecting that they will more prone for the osteoporosis, number one. So that is one part of the treatment, is giving calcium and vitamin D. And as I was mentioning, we are giving corticosteroid and we are giving to autoimmune diseases which are prone for osteoporosis. One thing which we give to everybody is calcium and vitamin D level in adequately amount, so that vitamin D is there in adequate amount, so that they do not develop what is known as osteomalacia in adults and rickets in the
Children.
So basically, that is one factor which is promote the osteoporosis in much worse way, and it causes a fracture. So the one part of treatment is giving vitamin D and the calcium, number one. Number two is there are enormous number of drugs which are available nowadays. When we suspect that, first is what he is saying, the alendronate, and then we have a different type of alendronate. They are available, that is intravenous, intramuscular is also available, and we have all forms of alendronate which is available, which is the first line of treatment. Then we have a subcutaneous injection of the monoclonal antibodies which are available. The two antibodies are available. Then hormonal preparation of parathyroid hormones are available. So more remdesivir, which is a new drug which has been available nowadays. So we have all kind of medicines are available, but these medicine has to be used very, very judiciously, because still the life is long. So we have to treat it for lifelong. So we have to start not with the best drug, but which more sustainable, that should be seen. And to my mind, the one drug which I use more frequently is zoledronic acid, which is given once a year for 3 years, and then after that, as Dr. Dave was telling, that we go for the drug holiday, and that has to be treated. So there are a lot of drugs are available depending on the age, depending on the risk factor, depending on the fracture, depending on the primary fracture is there. If secondary fracture is there, then obviously we have to go for the best. That means, as we are saying that the second fracture is much more vulnerable to second fracture. So to prevent it, we should use something like hormone preparation like teriparatide or densimumab, so that secondary fracture does not occur. For the primary fracture, the main drug is alendronate, group of bisphosphonate, and one of them is intravenous, which is given once a year, and which is very cheap, and which can be given easily also. So there are many good drugs which are available, and we have to, our armamentarium is there. But as we are always mentioning, that it is awareness that you should start building your bone bank. Number one, calcium, vitamin D, which is very, very easily available to us. That should be supplemented. And if needed, we have drugs which we can use.
All right. Dr. Batata, if you want to start early and build our bone bank, what should we do? Because there are two schools of thought. One says ki don't indiscriminately take calcium supplements, because then there is calcium deposits in other organs, in your arteries, and those issues come. Try to get it from your diet. Can we get vitamin D and calcium easily from our diets if I don't take milk?
Okay. So first of all, let me make you clear that milk does not contain enough amount of vitamin D. Okay, until as it is fortified. And India, most of the milk is not fortified.
Not fortified, yeah.
Okay, so the milk does not contain vitamin D. So the vitamin D source, easy vitamin D source is sunlight. Expose yourself for the sunlight from 11 to 2 p.m. Just expose your face and hands. That is sufficient for the synthesis of vitamin D. 30 minutes, 5 times a week. That is sufficient.
But Dr. Badada, there is an entire
entire
industry of sunscreens. Don't step outside your house without a sunscreen. You put sunscreen, you will not get vitamin D. So that's what everybody does.
Okay, then get fractured.
So please tell our viewers, because there is an industry running, and they think we need to protect our skin, so we must put this. But we have multiple diseases that come if you don't have vitamin D.
Yeah, it is very easy answer. That in that case, you just take vitamin D. That's simple. If you are using SPF above 15 or so, then you have to basically take vitamin D as a supplementation. And that is a very easy protocol. Once per week for 8 weeks, then once a month throughout life. So that is the protocol for vitamin D supplementation. Very easy. 60,000 sachet tablet liquid, that is international, that is available. That can be taken once a week for 8 weeks. Once the level is achieved, then once a month that can be taken. That is fine. Okay. Some of the group require higher doses if they are obese, if there is some certain other drugs. If their GI system is not okay, then maybe given intramuscularly injection is also available for the vitamin D in addition to the oral tablets or the syrups or the granules. So that is easy for vitamin D, not difficult. Now coming to the calcium. Coming to the calcium. So as Dr. Dave and Dr. Kapoor clearly mentioned that best would be to take your calcium through your diet. Okay. Now the problem is that if you want to take your whole calcium from your diet, it is not that easy. First of all, diet also does not contain very good amount of calcium. If the milk is good source of calcium, we'll take milk, 1 liter milk, then it will complete your source of calcium. So then you will get obese and you have to come to endocrinologist. Okay. So what you have
1 liter, I think is too much. 1 liter milk, I don't think anybody can have in a day.
Milk and milk products. So you can take, say, 250 ml of curd morning, evening, 250 ml of milk. So it can make around 750. And then 250 you can take from other sources like your beans in your diet or some pulses, some egg, or all these things can also contribute some amount of calcium. So that is one way. But many people does not like milk. But they like.
My daughter doesn't have any milk. No milk, no diet.
So yeah, she will like the what you call turmeric latte. So you can fool her by telling her this is a turmeric latte, that is a milk with turmeric, that will give you 300 rupees bottle. She will be very happy and she will take next time. Okay, so calcium source is easy. I think curd is best source. What I'll say, the curd, everybody like curd, and curd is best source, and curd can be taken many ways.
Like a smoothie or
as
a dessert.
As a dessert, you can take rice curd if you are South Indian. So the curd can be taken in many forms. So the curd is good source. Some amount of milk is okay. And if still it is not complete what we require, 1000 to 1200 milligram per day, then they can take 1 tablet of calcium also. At least about 50 years or 40 years, or especially for the females, because these are very food fetish. They don't eat usually. That is a common problem. So in that case, they can take a tablet of calcium once a day, or maybe alternate day is also okay. That is not a problem.
Okay. Dr. Dave, there's also a belief that I've heard many people say this. See, you're aging, so your bones will become weaker. Now you need to develop and strengthen your muscles, because what is going to support your body otherwise? If your bones are getting weaker, strengthen your muscles. So to strengthen the muscles, you again need those dumbbells and strengthening exercises. Is this good logic?
Let me use this word called silent sucker. We know that the bone we call this as a silent thief, because bone is getting still, stolen by these osteoclasts, and bone becomes weak. So the bone becomes weak, we call it osteoporosis. Same way, the muscles which you mentioned about, should we be strengthening the muscles, they also become weak as age increases. The body fat is increasing, the muscle mass is decreasing. The body size may remain the same, but the muscle which will decrease in the size, strength, and endurance, that is called sarcopenia. Muscle mass getting lost is called sarcopenia, like the osteoporosis. And these two duets, we call it as the two monsters walking together. And as age increases, who was the first one, hen or the egg? We do not know. Still we do not know who came the first, either the egg or the hen. Same way, these two duets, they walk together. That is false because of the sarcopenia or because of the osteoporosis, because of the weak bone. We do not know that. So as these two has to be addressed together, so muscle strengthening has to be done. And for that, along with the calcium and vitamin D, as mentioned by my previous colleagues, that we have to have the protein added as well. Because protein, Vitamin D is the muscle molecule along with the bone molecule, but along with that, if protein is taken, then the muscles also become strength. So this is called sarco-osteoporosis, sarcopenia osteoporosis, and they walk together. So muscle strength is equally important in order to have the balance maintained as well. And all these patients, they are likely to have some neurological disorder as well, along with the spine problem, along with the walking disability. So all these things has to be addressed in total. And what Dr. Sanjay said, very, very critical. A good doctor will treat patient as a whole, not just the disease. And we really need to address patient as a whole. So we really need to address, and this is where we lack into this telemedicine. You see, telemedicine, you are doing it everything virtual, and practically not always possible to get all the information to see everything as well. Anyway, we are not, don't want to distract on that. So basically, sarcopenia has to be addressed with osteoporosis, and muscle mass has to increase, muscle mass has to be addressed, because as age increases, muscle mass is also going to weaken, and we'll have the weak muscles as well. That will lead to frequent fall at home.
All right. Dr. Sanjay, I wanted to ask you, Dr. Kapoor also mentioned that there are some hormone type of treatment for osteoporosis. Now, all of you have mentioned that post-menopause, the risk of women getting osteoporosis increases a lot. This is because it's a rapid decrease in estrogen. Many women also go in for hormone replacement therapy to be able to deal with all that, falling estrogen deals to them. They have hot flashes, mood swings. So a number of women going for hormone replacement therapy. Would this protect you from osteoporosis?
Yeah, I mean, previously it was thought that hormone replacement therapy will help in preventing the osteoporosis, but it isn't. I mean, there is a big study which has shown that, I mean, there are very risk factors are there for the carcinoma of breast as well as the GI carcinoma. So, I mean, what we were doing the HRT has not been now recommended for the osteoporosis. Even if it has to be done, it has to be given in the minimum doses of estrogen has to be given, and we should not give combined with the progesterone and all. So, I mean, HRT for osteoporosis has not been recommended nowadays, and it has been found even the counterproductive. For that, I mean, these kind of conditions, we have other group of drugs which is known as SUMS, which are available to us, which prevent somehow somewhere in the carcinoma breast also is prevented by them. In those situations, we use that. So, I mean, HRT should not be given for the treatment of osteoporosis at this moment of time.
Dr. Sanjay, would you like to add something here? Because, if there is a hormone-related basis for osteoporosis, is there a way to manage it without risking other diseases?
Well, I think your question is very broad. Hormone, if you are using the term hormone, there is n number of hormones in human body. Okay.
More specifically estrogen here, because
okay,
because the estrogen drop, women are, prone to this.
That's correct. But see, because estrogen has many advantages in addition to the bone health, and many disadvantages are also there. Now people are scared with the disadvantage rather than the advantage. And I echo with what Dr. Kapoor said, is that we have better drugs to protect bones as compared to the estrogen. And that's why more and more people are using other drugs to protect bone rather than using the estrogen. The indication of estrogen is not bone protection as a primary indication. The primary indication is basically if there are symptoms because of estrogen deficiency in form of vasomotor symptoms, hot flushes, all these things. And for that, the treatment is estrogen. So in that case, they can use the estrogen and take a benefit for the bone health also. But if the bone, we are mainly targeting the bone health, then we did not to prescribe the hormone replacement therapy. We have many better drugs to protect the bones.
Okay, many better drugs to protect the bones. Dr. Dave, what are the do's and don'ts for people who have osteoporosis? Let's say that they are aged and they, have come to a stage where their bones are very brittle. How do they take care that they don't get into a situation where the bones could be affected, they get broken? What are the do's and don'ts for them?
Yeah, I think excellent question to guide the general population. Do's and don't. We usually say only one sentence to all our patients. Whatever increases your pain, you do that activity differently. That is one. Because undue stress will give rise to the pain, and pain is the only perception which can give us, do's and don'ts. So, like, sitting on the floor to be avoided, have the chair, sofa activity, have your back supported all the time, do kind of strengthening activity whatever way you can, along with the other diseases, other osteoarthritis that you have. So that is something which is very important for us as a guide. So not to do rotational activity because you already have the osteoarthritis set as well. So like elderly population, most of the yoga days, I would say that has to some extent increased pain of many of our patients because they start doing the activity on day one of the yoga day. They have not done it earlier. And like we are not like those who are doing yoga since years together, and you see something on the TV and then they end up with the issue. And by doing such activity, they even sometime occasionally precipitate the fracture because they have not done it previously and they are stressing their bones. So one sentence, one answer, whatever increase your pain, you do that activity differently or do not do that activity. If you have to do it differently. Use the stick. Anybody that you advise, why don't you use the stick? Then they say, no, I'm not that old, although they may be 70 years. So some kind of support has to be accepted. The most important
Yes, Dr. Bharat, 70 years is not old.
Well, so when you have osteoarthritis of the knee, and so that kind of the answer we get from our patient that I'm, but that is a good psych. But that psych has to be maintained. That high psych has to be maintained. That psych has to be nurtured in a different way. So that kind of activity restriction, activity modification, lifestyle modification, and I would say the diagnosis is very important in such condition. What is the cause? And so do's and don't, basically you carry on your physical activity, no complete bed rest. Even if somebody who has got a fracture, we advise them restricted mobilization lifestyle modification. And we call this a LSM, lifestyle modification, which is very important from the spine perspective. The minute you stay in bed, you lose 1% of the muscle strength per day. So somebody who is advised bed rest for 3 months, just imagine how the muscle mass muscle tone would have decreased. And that muscle tone will never be able to sustain that kind of activity level which patient is going to do after 2 months. So no bed rest. Strictly, you do activity in your pain limit. So that's the answer. Particularly certain activities like rotation, as I mentioned, should not be done. Floor sitting should not be done.
Okay. What about Dr. Dave, getting no slip mats, getting support beams in your bathroom or next to your bed? Would you recommend those also?
Yes, I think, and that these are the very important. Yes, I should have included in your question that change the environment, change the surrounding. Whatever you need to protect your body from the fall, like having railing, we should not be aesthetic. I think that you can become more aesthetic by providing the bedroom with the elderly with the night lamps, night light, having the toilets with the support, all around, should be supported. Then the fall is less. The prevention is taken care of, and people do not fall in the or do not sleep. So that is very important. So proper illumination in the bedroom, along with railing whenever they are walking around, so they do not have the fall.
All right. We're coming towards the close of the show. So I'm going to take concluding remarks from all of you. Let's start with you, Dr. Sanjeev. What do you think is the most important thing to do to fight this killer? Be careful in your old age, build your good health during your lifetime, a good diet, good lifestyle. What would you like to say in your concluding remarks?
Yes, I mean, as we have mentioned, we can say that, I mean, first of all, it should be started at the early stage, that is the adulthood. We should increase the intake of the calcium, especially in the woman child or females. I mean, it should be increased so that the bone bank is much more. Number two, the doing exercise is very, very important. Number three, as we mentioned that, I mean, protein is very, very important. That is 1 milligram per kg body weight around should be taken throughout the life, so that the proteins are much more. Number second, when we are reaching the menopause stage, then we should have measurements, or we should do the fracts in these patients, that whether they are prone for the osteoporosis or not. And at that time, if it is there, then we should give the calcium and vitamin D throughout the life. They should be taken, and we should measure their calcium intake and vitamin D, and minimize the intake of other drugs which is contributing to the osteoporosis. Then the third phase, when the elderly is there, or more than 70 years of age, then, I mean, beside these things, what I find is that, I mean, most of the people are developing neurological disorders in the form of dementia, some amount of Parkinsonism, some amount of muscle weakness. So that has to be taken care also, so that they should not fall. And as Dr. Dave was also mentioning, that is very, very essential that they should not slip. In the sense that most of the scene we have seen that, I mean, there is a soap in the bathroom, so they slipped it, and there is a wet flooring is there. So the flooring is very, very important, that it should be cushioned, and there should be cushions in on the floor also. And I mean, we should anti-skid measures should be taken in the bathroom also. So that is very, very important aspect when we are dealing with the elderly. So these are the measures which we should take, and whenever we develop that this patient requires medicine, there are enough medicines are available, and they should be used very judiciously. And as Dr. Dave was telling that, I mean, there is a side effect of giving osteoporotic medicine, that they do develop certain kind of fractures also, which is known as glass-like fracture. So, I mean, the drug holiday whenever it is required, but that has to be done by the endocrinologist or the person who is interested in treatment of osteoporosis. Like us, we are dealing with osteoporosis day in, day out. So these are things, measures which we should do to prevent fall and fracture.
All right. Dr. Badada, what would you like to say for your concluding remarks? How can one keep osteoporosis under check, if not completely at bay, later on in life?
Okay, so the prevention of osteoporosis starts from womb, and it will go till tomb. So what you say, womb to tomb, that is the one statement. Well, then finally, I think good nutrition, good exercise, another 2 words. Third is the fall prevention. That is another thing. Fall prevention is very important. So your environment, as Dr. Dave was telling, should be made fall free. Like switch in bathroom inside, it should be in the outside. So before you enter, you should switch on the light. All your bathroom should be very well maintained, clean, skid-free, tiles, gray bars, your lifts, your corridors, everything will be well equipped. And don't go outside in sleeper, always wear shoes. Don't go in the crowded places, because that will cause fall. So because unless a person will fall, he will not have a fracture. Except Dr. Dave documented few fractures spontaneously in the bed. Those are very, very rare. So the fall prevention is very, very important.
All right. Dr. Dave, your concluding remarks, what did you say?
Sure. I have few points to raise and to conclude. One thing is, when we are born from the childhood, we are like this. So in uterus, our whole body is like kyphotic. And
You're like a
as
ball.
age, yeah, that's right. We are crowd, you know, we are all like that. And as age increases, the same attitude is occurring to our body. We go back to what we were. If you look at all other organs, you know, we lose the teeth. We were born without teeth. We lose the hair. We were born without hair. And as age increases, we do that and we develop that. So that's an aging process. And this aging process, you cannot stop. So somebody who is born is going to die. But then how do we prevent how do we have the good quality of living in this era where we are going to have that? So kyphotic posture, when you see it developing, then that is the red signal or red flag for osteoporosis. We need to investigate. Second thing, generalized pain, generalized bone pain, generalized muscle pain, that is to be addressed early. My colleagues have said prevention is better than cure. Yes, that is something which we should have, the primary prevention and secondary prevention. I won't address that. As a spine surgeon, we always teach our patient, when there is one fracture, second is on its way, because the bone is weak. It has fractured the maximum stress bone. So second is going to occur. So do not ignore. Get yourself treated. And there are health checkup programs, like we have a spine health checkup program, where we have the full length X-ray done, full length MRI done, DEXA scan done. So we really need to do that. There is another term called secondary osteoporosis, which we did not address, but that is something which happens because of the drugs, which happens because of certain diseases. So that has to be taken care of. So secondary osteoporosis has to be taken care of. At the end of the conclusion, if I have to say, sarcopenia has to be addressed. These duets, they walk together. So both the monstates has to be tamed at the same time, as told by 1 milligram per day, you know, the protein, we have to take that. So this is my conclusion, that the bone health has to be considered as the primary need after the menopause and after 70 for the elderly gentleman.
So
All right.
that protein is 1 gram actually, not 1 milligram.
Yeah, not milligram.
Yeah, 1 gram.
1 gram,
1
per
gram.
body weight.
Calcium is 1000 to 1200 milligram. Vitamin D is 800 to 1000 international units per day.
Yeah.
Okay. And everyday exercise 35 to 45 minutes. Best is the walk, and environment should be fall free.
Yeah.
Right. Thank you so much, gentlemen, for joining us today to create awareness about osteoporosis, the silent killer of the bone, something that we want to avoid in our older age. We want to be prepared and strong to be able to lead a good life in our twilight years. Thank you so much for joining us and talking to us about osteoporosis to raise awareness about this problem. Thank you.
Thank you.
Thank you. Namaste.
With that, we will wrap up the show. To follow us on Facebook to get all the updates on our upcoming programs. Till we meet again, stay safe, stay healthy, and take care. Goodbye and see you soon.
Thank you.